Hello everyone. Uh, I'm Dr. Rajesh Jha. I'm working in Artemis Heart Center, Raj Hospital, Ranchi. Today we are going to discuss on few topics like the tips for living with diabetes and heart disease. We have seen so many patients who are suffering from diabetes, especially in India. In urban population, it is around 20 to 30% of the populations are suffering from diabetes. And as we know, the diabetes is the mother of all disease. So all the diabetic patient or maybe the hypertensive patient, these are the major risk factor for coronary artery disease. And those who are having this risk factor, they are most prone to develop coronary artery disease. Maybe may present with the chronic stable angina, they may present with the acute heart attack. So I will give some tips that how we can uh, stop or we can uh, halt the process of coronary artery disease. So the first tip is the lifestyle modification. So in today's world, the mostly in India, the young populations are suffering from the diabetes and the heart disease. So for the young population, it is very important that they must work for means they must exercise for 30 minutes every day, and that should be the brisk exercise. The second is the food habit. The food habit is very important because many of us are today we prefer junk food. So we must avoid the junk food, and according to the area of the India, whatever the traditional food that we must take. Then many of us usually skip the early breakfast. But so my message for them is that you must take a heavy breakfast every day. Then thereafter, the thing is, the red meat. The question about the red meat is usually asked by the patient. So we try to avoid the red meat because red meat is very rich in fat and it is not very good for our health. Then the sleep, total sleep at least it should be 6 to 7 hours a day. The study says that those who are taking 7 hours per day of sleep, sound sleep, uh, they are less prone to develop diabetes or stress related disease. The one of the major risk factor for the coronary artery disease and diabetes is again is the stress, because in today's world the young populations are suffering from tremendous stress, and that is the workplace stress. So we must avoid taking the stress, and for that it is necessary that we must take a sleep of more than 7 hours. Then there are a few myths about the diabetes, that once the treatment for the diabetes is started, they will have to take it for lifetime. So this is a myth. If somebody is diagnosed as the new onset diabetes, that is diabetes type 2, and if they are obese, if they will reduce their weight, if they will control their food style, if they will have a good sound sleep, then there is chances that in few patients we can stop the medicine or we can reduce the total dose of the medicine. So the lifestyle is very important for this diabetes and the heart disease patients. Again, one more important thing is the patient with the diabetes, they usually they suffer from hypertension also. So everybody, those according to the guideline, those who are more than 40 years, they must undergo a proper blood investigation for lipid profile, for your diabetes, for your heart echocardiogram and ECG. And thereafter, if everything is normal, they must undergo this investigation repeated every 2 to 3 years. If somebody is having diabetes, they must take the medicine properly as advised by the doctor. But along with the medicine, the food style is very important, sleep is very important. They must avoid the junk food. In today this year, World Heart Day, the theme of the World Heart Day was that we should not focus to ourselves, we should also focus to the society. So it is our duty to educate the people living around our society to have a healthy lifestyle, to have a fresh vegetable and fruit, and that is the total number of 5 fruit and vegetable every day. Then we must make our society aware about the heart disease. If they are having any type of chest pain, they must evaluate it immediately with any nearest physician, because most of the time we see that the patient comes with a heart attack after 4 to 5 days, and the reason behind is that they initially they treat themselves by the over the counter drug for the gastritis, and once if they are not getting a relief with that, then after 4 to 5 days they comes to us, and that is very hazardous, because once that after the heart attack, if we are delaying the treatment, we are making a more complicated complication for the patient. So this is very important. Then there is one question that what kind of the edible oils for DM patient with the cat is advised. So the from the oil point of view, I have written many article also, that there was one research which was done in the AIIMS in Delhi, and in that we found that according to the area of the India, because in the eastern India we prefer mustard oil. So the mustard oil, they worked on mustard oil, and they say that the mustard oil is the best oil which we can use. The second other oil is like soybean oil, sunflower oil. We can rotate the 2-3 oils in a month. One more important thing is that there is people are now using the olive oil. So there is a myth that olive oil is very good for heart. Yeah, obviously it is good for heart, but olive oil preparation is, it should be at the 20 or 30-degree temperature only. In India, mostly we make our food at 70-80-degree temperature. So the olive oil converted to the saturated fat, which is not important. It is equivalent to the dalda. So we must avoid olive oil. If we are using olive oil, it should be taken with the salad only, because it is the continental oil, and in the continental food usually people boil their food and then they pour the oil over the food, and not they prepare the food in that oil. So this is a myth and we must correct it. There is one question that what we should do for the stress. तो गजाला जी, स्ट्रेस के लिए तो मैं यही बोलूंगा कि वी मस्ट टेक ए 7 to 8 hours of sleep, sound sleep. Then we must do some yoga or some stress relieving exercise in the morning to with the concentration, because anyway if you are taking stress, you are not getting any benefit from that, and it is not going to solve your problem also. So the stress is we must avoid stress as soon as possible. That is not good for our health. So so I would like to conclude my point that for the lifestyle modification, we must exercise first for at least 20 minutes every day. If we are not able to do exercise every day, we must do 150 minutes per week and divide according to our convenience. Second, food style, it should be the localized food, whatever we are taking in local area, we must take that food. Third, for the oil, as raised by one of the viewer, and oil, mustard oil is the best. We can also use ghee on chapati or in the food also. Ghee is very good if it is pure ghee. Then we must avoid the chocolates, junk food, because that is not good for us. Again, the smoking is very important. In one of my study, I found that the 70% of the population who were less than 45 years, they had heart attack, and in 100 patients, 70 were chronic smoker. So the smoking is very hazardous. We must avoid, and that is my concluding point. And we must live a healthy life. Thank you.